Are you losing your hair and you want to get it back right away? I'm Dr. Rob Berberian, Newport Beach, California, and I'm going to show you how. Who am I here with?
I'm John.
Nice to meet you, John.
Good to meet you too, doctor.
What made you want to get a hair transplant?
I just don't like the way my hair is super thick on the sides and back and then really thin on the top. If I grow it out at all, I don't like the way it looks.
Okay. The plan for John today is to do 3,000 grafts. What we're going to do is we're going to recreate a new, natural, artistic looking hairline. We don't want to do a straight line. We don't want to do it in the middle of the forehead like some people ask for, because that looks very unnatural. So we're going to give him a very natural looking hairline. We're going to put about 2,000 grafts in that front half to give him maximum density, and about 1,000 grafts in the crown. That way it's evenly distributed all across from front to back and giving you maximum density in one session.
Awesome.
Are you ready?
I'm ready.
Let's do this. This is your new hairline. We didn't bring down the center part, we just lowered the temples a little bit. And we're gonna fill maximum density here. And then put 2,000 grafts and 1,000 grafts in the crown.
Awesome.
We're going to be doing PRP for John. The advantage of doing PRP is when we do the hair transplant, it has your own natural wound healing growth factor. So when we're placing the grafts and we have PRP in the scalp, it allows for expedited healing of the hair transplant procedure, and it allows the transplanted grafts to grow out a lot faster with PRP versus without. So if you weren't to do PRP, it takes about 6 months to start seeing the first few hairs growing. With PRP, we see it as early as 2.5 months.
Awesome.
So it helps to expedite the process, but also John still has a lot of native hair, so we want to protect that. The PRP helps minimize shock loss, but also prevents you from having excessive hair loss over the next 5 to 10 years. So you can do maintenance PRP once every 6 months to help prevent significant hair loss and maintain what you have, so that way you're not back here in a couple of years for a second procedure. So we want you to maintain every single hair that you have, so that way once the transplanted grafts grow, and these are permanent and lifelong, then the results will look mind-blowing.
Awesome.
So what kind of fade do you want? I just finished doing the extractions. I did 3,000 grafts from John's donor area. How was this part of the process like for you?
It was good. It's a
Are
little
you
tiring.
Yeah. Are you in pain though?
No.
No pain. Perfect.
No.
Now that we're done with the extractions, the next part is to continue numbing the top and then make the sides and then place the grafts. I just finished making all the sides. We did 3,000 sides, basically redesigning a new hairline, 2,000 grafts in the front half and 1,000 in the crown. So now that we finished that part, we're going to be injecting the PRP. Are you feeling any pain?
No.
You just finished doing 3,000 grafts.
It's crazy.
You're done.
Yeah.
You survived.
Yep.
So how was your experience before we do the big reveal?
It was very good, very professional. Everybody was great, and I felt safe and comfortable the whole time.
Perfect. Ready to see your new hair?
Yeah.
All right, take a look. You can come a little closer.
That is gonna look great. Man, there was no hair up there when we started.
So you have a brand new hairline, very natural looking. We don't want to bring it too low and do a straight line. So it's a little bit wavy. And we filled in the sides.
Very little hair up here. I mean, this was just pretty much shiny before you did the graft.
So it's all filled, 2,000 grafts in the front half and then 1,000 in the crown.
Awesome.
And then your donor area looks really, really nice. Once it heals up, you won't see any scars at all.
I'm super excited. Super excited.
You want to do it again?
No.
Done. So a few months and then the new hair will start growing because you did the PRP. We'll start seeing it a little bit sooner.
Cool. Yeah. I'm very happy.